Now we're going to show you a basic part of a ventilator check, which is routine oral care for a patient. You usually do this every time you come in to check the ventilator, or once a day. It just depends on the orders that the doctor gives. So for this one, since it's the first oral care of the day, we're going to use our chlorhexidine packet, which is a antibiotic mouthwash, to make sure that they don't get any thrush and take care of their oral hygiene while they're on this ventilator. So in order to do this, you want to make sure that you introduce yourself to the patient. Of course, you probably did that when you were coming in for your ventilator check. You want to make sure you have a working suction. You want to make sure you have this oral care kit right here, which comes with a brush, mouthwash. Sometimes they need chapstick. Their lips can get a little crusty from breathing and on the ventilator. So what you're going to do is you're going to crack this packet open. Usually you just press it, which floods this little area and allows the toothbrush to be dipped in. Normally you don't want to put it on the patient bed, but we don't have a table right now, so you're just going to put this right here. Make sure that the oral care brush has enough liquid on it, and you're going to want to connect it to the suction. You're going to start by putting this in the patient's mouth. You're going to brush his teeth, sides of his cheek, his tongue, the roof of the mouth. And you want to do this on both sides. So you go to the other side, making sure you're suctioning out any excess mouthwash or spit they may have. While you're doing this, you kind of want to look into their mouth and make sure that you don't see any sores, make sure that you don't see any thrush starting to occur. Once you're done, you want to make sure you unplug this and connect it back to the inline suction. Make sure that it's working. Of course, you want to lock this when you're done. Put it away from the patient. And lastly, when you do the oral care, you want to move the tube to the other side of the mouth to help prevent sores building and making them get some kind of like blister or some sort of sore. And then after that, before you would do that, you want to make sure that you check the patient's allergies to make sure they don't have any allergies to the mouthwash or any type of product that you're using. Yeah, that's how you take care of a patient's oral care.